Scarless thyroid surgery does not leave a visible neck scar, even though the surgery still occurs at the lower neck just above the breastbone. What we do is use cameras and equipment that are very similar to a laparoscopic gallbladder surgery, and we hide the incisions on the inside of the lower lip. We then tunnel over the chin to do the surgery hidden under the surface. The risks of scarless thyroid surgery are actually very similar to the risks of regular thyroid surgery. Best we can tell from the data that's available, because it is a new procedure, are that the risk to the parathyroid glands and the voice box nerves or laryngeal nerves appear to be very similar and are very, very low. Some of the risks that are unique to scarless surgery have to do with how we get there, or the tunneling procedure, where we put the scar or incision on the inside of the lip and tunnel over the chin and down to where the thyroid sits. We do see some patients that have some weakness and numbness over the chin and over the lower lip muscles. It is possible to get skin burns along the tracks of the tunnel, either in the middle or off to the sides, although that is rare. It is very, very rare to see gas embolism, or gas that's absorbed from the body from doing the procedure, that causes problems with low blood pressure. That's a very rare complication. The recovery after scarless surgery is pretty similar overall to regular thyroid surgery. You still will see some bruising and swelling in the lower neck just over the breastbone. There's not a visible scar on the outside, but you do also see some swelling, bruising, and numbness as a result of our tunneling, or where we've hidden the incision. So most patients will have some bruising around the chin, some numbness and temporary weakness of the lip, and then a small incision and some stitches on the inside of the lip that do dissolve. There is some additional care or recovery regarding the lower lip and the chin after scarless surgery. The stitches on the inside of the lip all dissolve on their own in a little bit over a week. We ask patients to be very careful when they're brushing their teeth or when they're chewing food, because again, the lip and the muscles around the lip can be a little bit weak temporarily. When deciding who is a candidate for scarless surgery, we take into account patients' medical diagnosis and why they're having surgery in the first place, the size of the thyroid gland and whether or not we think it's possible to remove it safely through the tunnel, as well as other medical concerns. Some patients with hyperparathyroidism or parathyroid calcium gland problems can be considered for scarless surgery. It's best to talk to your surgeon about this approach, as there are other things to take into account. Patients that are not a candidate for scarless surgery are patients with very large thyroids or advanced thyroid cancers or tumors, patients with severe heart or lung disease that would make the extra anesthesia time or the gas that we put in more stressful for them, or patients that have had prior neck surgery or radiation treatments to the head and neck.